Welcome to The Public's Health, a production of the Alameda County Public Health Department. This is a new show designed to invite you, the public, into the workings and doings of your public health department. I'm Dr. Tony Iton, the Alameda County Public Health Officer. With me today on our inaugural show is Arnold Perkins, our illustrious director of the Public Health Department. Arnold, welcome.
Thank you. It's a pleasure to be here with you on the first show.
You run a large public health department that serves an enormously large and diverse community. What's your perspective on your job?
First of all, it's a wonderful challenge. I've done many things in my life, high school principal, run a business, been a family therapist, been on the faculty of various universities, and I found home in public health because it's about keeping folk healthy, working with the community to assist them in creating a healthier environment where wellness is the focus and not illness or sickness. So it covers so many different areas. It covers work with children, work with adolescents, work with parents, work with men, work with women, chronic disease, communicable disease. So it's a range of things that come together. And the focus is to prevent people from being sick, to prevent illness.
And I understand that when you took this job, one of your key messages was to put the public back in public health. What do you mean by that?
Well, I mean that there's no way that a public health department of 600 people can do all the work. The way the work has been done is within the context of the community, with the assumption that people living in a community have answers to their health issues and their health needs. They might not have access. And so our role as a public health department is to act as a resource, to provide consultation, as well as to learn from the community, to work in the context where people live and assist them in creating wellness and creating health. And I often talk about dis-ease. Dis-ease leads to disease. So if we can work to alleviate some of the dis-ease, then we have far less disease within our community.
That's fascinating. Now, Arnold, can you give us an example of how you've implemented some of these ideas in the actual work of the Public Health Department?
Mm-hmm. One of the things when I came to the department, the way of putting the public back into public health is to create community health teams. We have 10 community health teams, 2 in each of the supervisorial districts. And they're made up of our public health nurses and our community outreach workers, as well as working with some of the city staffs. I'll give you 2 examples presently. We're working in the West Oakland community, and we're working in Sobrani Park, which is East Oakland. And in those communities, we're working to organize the residents of those communities around various issues. One issue that comes to the fore all the time is the issue of youth. What do we do with our young people? So we're working on youth development, not violence prevention. We want to have to flip the script. So we're working on youth development. How do we develop our youth to be good, productive citizens? Another issue in many of our communities is that of blight. So how do we work with the cities to clean up blight so that people feel good? I always say, and this is often corny, that roaches don't like where it's clean. So there's not a lot of negative behavior in communities that are clean. In communities that are dirty, there are a lot of negative behavior because it breeds that type of behavior. So our mission is to work in youth development to help young people, as well as the other residents, clean up their community. And that deals with the issue of blight. And also other issues like unemployment are major issues within our various communities. So these are some of the areas we're working specifically in to cause there to be a change or a difference in many of our communities.
So you have a pretty broad perspective on public health. I understand recently you were in Zimbabwe. Can you tell us a little bit about that?
Sure. We have had 3 partnerships, one with Russia, one with Azerbaijan, which we're currently doing, and one with Zimbabwe. What we're doing in Zimbabwe, we're working with Children's Hospital on psychosocial issues. Many of the young people have lost their parents. A third of the population have lost their parents. So no one deals with the psychosocial issues. We're working with Alan Temple, who has an AIDS ministry, and we're also, as a public health department, assisting in outfitting a hospital with used surplus stuff that comes from UCSF, comes from Kaiser, and some of the county surplus materials to help outfit this hospital. Then treating over 400 HIV/AIDS patients. So people see miracles on a daily basis when someone is brought in a wheelbarrow, and then within a month of getting antiretroviral drugs, they're up walking. So for those folk, it's a miracle. We don't see that often here, but so that's some of our work, is to spread some of the surplus we have here to other countries that have nothing at all.
Wow, Arnold, so you've taken us from East Oakland to West Oakland to Zimbabwe to Russia, all of that in one job. That's a fascinating breadth of experience you have. Now, one of the other things that we're going to hear about later in the show is how our public health department and many others responded to Hurricane Katrina. Any thoughts, any ideas about how that might affect your vision of public health here in Alameda County?
Well, I was very proud of what your, as a county residents, employees did in public health. They stepped up and helped to person the hotlines. We had some of our nurses and other folk go down to the south to help in that disaster. And one of the things that I'm constantly aware of, and we often talk about, is, are we prepared for disasters? It's at the utmost upper part of my mind, because I know we will have an earthquake, and I do feel comfortable that we are well on the road to being prepared.
And that's the question we're going to try to answer in the rest of this show and in subsequent shows. Thank you so much, Arnold, for being on our inaugural show and being our inaugural guest. We're very, very pleased to have you as our director, and we hope that this show will continue to showcase some of the ideas that you've put into place in Alameda County. We're now going to look at some interviews that were done in Baton Rouge by some of our public health nurses that spent time responding to Hurricane Katrina in response to a call from the Red Cross and other agencies like the California Nurses Association to go work with their brothers and sisters on the front lines of disaster response.
We were at home 800 miles away crying, not just for the people who had lost so much, but knowing that all of those people were suffering and there wasn't enough help.
And I didn't understand that, because we was there and they seed us, and why would they circle and why would they wouldn't come down to help us? And I feel or believe if they would have came like they were supposed to and come got the people, because we was hollering help, help, I said, and then it wouldn't been so many drowning people.
It's been very humbling to be here, and they talk about losing everything. You're right, you know, and everything, literally everything.
Clothes,
and so you're right.
shoes,
going home.
couch. I mean, you can't go home.
Right.
There's nowhere to go
There's no
home.
home to go to.
With the inception of the original special needs shelter, it was supposed to be staffed by public health nurses who, on a day-to-day routine, I think basically help do pelvic exams, give immunizations, and they ended up starting IVs, doing acute inpatient care, administering medications.
They're just so happy to have nurses coming in from all over to help them. So I think that the response for the help has been beautiful.
It's not just nurses from Tulsa, but nurses from California, Arkansas. We've seen nurses from Tennessee, Florida, that have volunteered their time to come for our sisters and brothers in health care. That's something I've never seen before, and I don't know if I'll ever see again.
Yeah, one other recommendation I'd have, the volunteers from across the nation have been absolutely wonderful. But a problem I've noticed is there was no central repository for the volunteers. Some would go to the field house, show up and say, put us to work. Some would go to church shelter, say, put us to work. And I think for better use of manpower, there should be a central repository where the volunteers call in, put their name on a list, put what their specialty is, and then they're actually deployed from this central repository to where the need is.
I understand that this hurricane has been disastrous, you know, and they've been through hell and back, but it's also pretty evident that they didn't have the resources, the equipment, or the manpower before this occurred?
I don't think it's one thing. You had a huge breach in a system that holds back the Mississippi River, you know, and a vital link throughout this country. But as far as preparing for something like that, it's impossible to take a metropolitan area of 1 million people and say if something disastrous like this happens, you can be prepared for it. You know, the only way to prevent anything is just that, to prevent it ahead of time.
I remember specifically one lady came in with a yellow sticky, her name on it said not ambulatory. She couldn't speak. There was no way to communicate with us. We had no idea what was wrong with her medically, no idea what medication she had been taken, where she had been treated, or anything.
I didn't know the name of the medicine, but I told the doctor exactly, like I told you, what it's treatment for.
Right.
And so I guess they figured it out.
I think what has happened here has brought nursing together in a way that if we will act on it, it can be a pivotal turning point in uniting us all over the United States.
Welcome back. We're joined now by 2 nurses from the Alameda County Public Health Department, Larry Vitale and Albert Pappalardo, both of whom were sent by the Public Health Department to respond to the disaster in Katrina by working with their brothers and sisters on the front lines in hospitals. Welcome.
Thank you.
Larry, why did you respond to this disaster?
Well, I'm a public health nurse, and I take the public in public health nurse seriously. I'm a civil servant, a public servant. So in responding to a time of a disaster, I certainly would expect to respond if it was a natural disaster here in Alameda County, or if it happened in another jurisdiction within the state, as we have in the past with earthquakes in Southern California, or in this case with Hurricane Katrina. It was a time of national disaster, certainly swamping, overwhelming the resources that were available in Louisiana. So I really felt that it was my privilege to be able to lend my hand, not just to wring my hands and say, oh, I'm so sorry that what's going on, but to actually be there. I'm very proud, too, of the response of our agency director in allowing us, giving us release time to be able to respond. Mm-hmm. And so many of us did respond. There's just 2 of us here, but many have gone. Others are waiting to go as the unfolding of this disaster response continues.
That's wonderful. Albert, you're a nurse and a video documentarian. So this particular opportunity presented for you sort of a dual opportunity with respect to what you might find in the disaster zone. Tell us a little bit about how you felt going down there and what you saw.
Well, as a nurse, I'm trained to respond to need. When I see people in need, I try to help, and I am fortunate to have the privilege to have gone and to have worn 2 hats. I have experience as an urgent care nurse, and so in addition to being a public health nurse, I was able to go down there and contribute urgent care nursing skills to the emergency room of the Earl K. Long Hospital in Baton Rouge. After my duty on the floor, so to speak, in the emergency room, I was able to, as a public health nurse, conduct interviews with some of the staff of the hospital, some of the volunteer nurses and other personnel that responded from all across the country, and to interview some of the evacuees from New Orleans. And we are now in the process of making a documentary to give voice to some of those people and to try to learn some lessons about the disaster response that we can use for our community here in Alameda County.
And that's really important. Larry, lessons learned, what are they? How can we do disaster preparedness better in Alameda County, or what did we learn from this disaster by being on the scene?
Well, my experience, and from my experience, there are a couple of lessons that I bring back, but my experience was that I went to Louisiana with the Red Cross, and from the center, the staging area in Baton Rouge, I was teamed up with nurses from various parts of the country and sent down to southern Louisiana, Terrebonne Parish, southwest of New Orleans. I worked in a shelter, a large shelter that was in a, basically it's a gymnasium on a college campus, 500, almost 600 people living in this gymnasium. We were providing medical care.
So in essence, you really got a sense of what people were going through down there.
These were residents of New Orleans that were displaced.
And we're going to see one right now in a piece shot down there on the scene to give us a sense of what people experienced and the implications for Alameda County.
Hi, my name is Keisha Windsor, and I was a victim of the Hurricane Katrina. I was located across the canal in New Orleans, Louisiana. And the hurricane, it was a disaster. I mean, they never even came to pick us up for the bus to go to the Superdome, so we had to go back home. We didn't have any transportation. So when I went home, I was watching the news and I was laying down in the water. It rushed the house, so I climbed in the attic thinking that would help me. And in 2 minutes, the water took the whole house away. I was caught in the current. A board came and knocked me out of the current, and the water pushed me like 6 blocks away from the house. I breathed water in my nose and my mouth for 6 blocks until I bumped into a tree. I climbed the tree, and I stood in the tree for 2.5 days. While I was sitting in the tree, I seen bodies floating by. I dodged snakes and water moccasins. I mean, it was hell itself. And I never want to go through that again. I'm never going back to New Orleans again. Now, what I have to say about the system, I think the system was brutal. I mean, they took, it was favoritism. I think my opinion was it was favoritism on sides of New Orleans, the mid-city area, the French quarters, never flooded. I believe that the dams was broke on purpose. I think it was purposely broke. And my house sat right in front of the levee, which is on Desalone and Galvez. And my body and my house was rushed from Desalone and Galvez to Andrew and Galvez. And that's the tree that I climbed on, Andrew and Galvez. And I stood in that tree, and how I got rescued was I was playing with a cup, and a helicopter happened to see the cup because it was white styrofoam. And he stopped, and when the ambulance stopped, that's when I waved and I hollered for help. The ambulance immediately sent a boat to come pick me up, and that's when I was rescued from Hurricane Katrina. Being in a tree was a very horrible and trying experience. It was dark at night. I couldn't see anything. I couldn't sleep. There was no food. I couldn't drink water. And my stomach, it got bloated. I had inflammation from my neck, my chest, and my stomach. My ankle it wasn't broke, but this is how it looks from the hurricane. And my stomach, we still trying to find some kind of way to get this swelling down from my stomach. It was so dark. But the second night, being in the tree, the Lord sent a moon, and the moon was so bright to where I saw everything in sight. I've seen nutria rats try to climb the tree. I've dodged snakes, water moccasins, and the water, I thought it was going to be 18 feet, but the water was not 18 feet. The water was at least, I'd say 30 feet at the most. After everything was over, I didn't see a rooftop in sight. It was like it was me in a tree in the middle of the lake. And it was very scary. It was scary. And I cried and prayed, and I cried and I prayed, and God answered my prayers and gave me a second chance, and here I am. I was rushed to about 5 medical cares that didn't know what was wrong with me. They couldn't diagnose what was going on with my stomach and my legs until they sent me to Baton Rouge. And I went to Blue Bayou. And Blue Bayou, they pumped my stomach up and they inserted IVs and gave me antibiotics and fluids. And that what got my stomach down, but it's not all the way down. I'm back in the hospital again. I would say that my final thought is this. If they say that there's a hurricane on the way, leave as far as you can go. Don't even stay in Louisiana. Leave.
We're joined now by Zerlyn Ladua, a family nurse practitioner and the Alameda County Bioterrorism Coordinator. Welcome, Zerlyn. Now, we've seen the devastation that Hurricane Katrina managed to cause to low-income populations in New Orleans and elsewhere in Mississippi and in the South. As the Bioterrorism Coordinator, what are the implications for you about how we do disaster preparedness here in Alameda County with respect to how we prepare low-income populations?
Well, what we've learned from Katrina is that low-income populations are special populations with special needs and virtually few resources. And it's our job as a public health department to connect the resources and support this special population in disaster preparedness.
And how have you done that? Give us some examples.
We've had a couple of projects focused primarily on low income. We had one project in Sobrante Park where we did a door-to-door needs assessment and provided resources such as what you see in front of us to the participants.
Really? You went door to door and actually gave out these packs to people in low-income communities?
Yes, we gave out these packs, and the contents of the packs, as you can see, are flashlights, food, and water. It's a 4-person pack that a family of 4 can survive for 3 to 4 days.
Now, after you gave out these packs to these populations, what did you tell them?
We provided trainings. We partnered with the Red Cross and we provided trainings. This population is a low-income African-American population in the city of Oakland and also a Spanish-speaking community. So we provided trainings with the Red Cross in both English and Spanish, basic disaster preparedness trainings.
Are you planning on doing this elsewhere in Alameda County?
Yes, we're planning on doing this in the city of Fremont. The city of Fremont is a little different from Oakland, where they are very community rich in disaster preparedness. They have a disaster coordinator, Vic Valdez, who works with the Boy Scout troops. He's got neighborhood watch programs, and he also has a very strong Citizens Emergency Response Corps. So we're planning on partnering with them, identifying the low-income communities, doing another assessment, providing the packs, but instead of doing the trainings, we're trying to partner with Vic to support his community services with this population.
So in essence, what you're saying is that in those first 48 to 72 hours, 2 to 4 days or so, people really need to prepare themselves and be expecting the government not necessarily to be there, and in fact have to come up with plans for themselves, such as a kit and a plan to communicate with their families in the first few days after a disaster. Is that what you're saying?
Yes, we're trying to get people to think about getting their own house in order, trying to support themselves, and then connect the community, if there are resources in the community, with these folks.
So is this the lesson from Katrina?
Yes, this is the lesson from Katrina, that it's our job as a public health department to identify low-income populations and provide resources and support to these folks.
Tell us a little bit about some of your other partners in this effort.
Some of the other partners,
I understand the City of Oakland is working with you.
the City of Oakland is working with us. With Oakland, since it was a very poor community with not a whole lot of resources, we've actually stationed public health folks to try to develop leadership skills and advocacy skills for this population.
Oh, interesting. And some of your other partners?
Some of our other partners with the City of Fremont are community-based organization, CARD, the fire department, and other resources.
Oh, that's great. Well, this is a very unique thing that you're doing, and I applaud you. Thank you for watching our show, our inaugural show, and it's on the public's health. We believe that this public health department is your public health department, and the resources of this public health department need to be shared with the community, and particularly those that are most in need. We encourage you to visit our website at www.acphd.org or to call us to hear about upcoming information, for instance, the flu campaign, which we hope to be talking about soon, and many other critical public health needs. Thank you, and goodbye. So that was fun, wasn't it?
Yeah.